I wish to address the public regarding the confirmation of 2 cases of measles in Bermuda. First and foremost, Mr. Speaker, our thoughts are with those infected individuals and their families who received treatment at King Edward the 7th Memorial Hospital and are now at home, and we wish them a swift and full recovery. Mr. Speaker, measles is a highly contagious disease, but I want to reassure the public that the Ministry of Health, under the guidance of the Chief Medical Officer, is taking all necessary precautions and measures to contain the situation and prevent further spread. Protecting the public's health is our top priority, and that is why, upon confirmation of these cases, the following action plan, Mr. Speaker, was immediately implemented. First, contact tracing. Through our public health team, we have launched a comprehensive contact tracing exercise to identify and notify individuals who may have been exposed to the affected cases. Those identified are being monitored and, where appropriate, offered post-exposure preventative treatment. Where relevant, those persons have been excluded from school and workplaces, and we urge those persons to heed the advice of the Ministry of Health. These measures are vital to reduce the spread of this disease and protect your fellow family, friends, and neighbors. Secondly, Mr. Speaker, increasing public awareness. We have launched clear guidance on symptoms, prevention measures, and what to do if exposed. This is being communicated through multiple channels, including social media, community organizations, and healthcare providers. Thirdly, we are boosting vaccination drives for the public. We are renewing efforts to offer the life-saving measles, mumps, and rubella, or the MMR, vaccine in the community. Vaccination clinics have been bolstered and expanded to ensure all eligible residents, particularly children and unvaccinated adults, can access the vaccine. For those who may have missed a dose or want to catch up on their immunizations, vaccines are available to all eligible children and adults at the Hamilton Health Center, as well as private doctors' offices. Fourth, Mr. Speaker, we are working in close collaboration with healthcare providers. We are working closely with them across practices in Bermuda to ensure rapid identification, testing, and isolation of any suspected cases so we can quickly take action if needed. And finally, safe infection control measures are being upheld and reinforced. In settings such as schools, workplaces, and healthcare facilities, infection control measures are being strengthened to minimize the risk of further transmission. This involves measures to cover coughs and sneezes, wash hands, and disinfect surfaces. The Ministry of Health has provided clear advice through the Ministry of Education to school administrators. While measles is preventable through vaccination, it is critical that we remain vigilant. Mr. Speaker, current statistics show that Bermuda has fallen well below the WHO's recommended rate of 95%, which is required to achieve herd immunity and eliminate measles. Vaccination rates for children, who are the most susceptible, currently sit at less than 40%. I know. The outcomes, if measles is contracted, can be dangerous, with severe complications such as blindness, diarrhea, and breathing problems from pneumonia, which can result in hospitalization. Complications are most common for babies and young children under the age of 5 years old. So I encourage all residents to verify their vaccination status and ensure that they are up to date. A reminder to all is that once you have had the MMR vaccination against measles, you do not need to do this again. If you are unsure of your vaccination status, please contact your healthcare provider. Mr. Speaker, symptoms of measles include fever, cough, runny nose, red eyes, and a characteristic rash. If you or a family member experience these symptoms, please stay home and contact a healthcare professional for advice before visiting a clinic or a hospital to reduce the risk of exposure to others. And for those who are planning to travel, you should be vaccinated against the measles at least 2 weeks before international travel. If your trip is less than 2 weeks away and you're not protected, you should still get at least one of the doses, the first dose of the MMR. Mr. Speaker, it is important to protect our communities to prevent the spread of easily preventable diseases like measles. And so to increase immunization rates, the ministry will be looking to develop a targeted immunization strategy in the new year. Bermuda has faced public health challenges before, and together as a community, we will look after each other to manage this one. The Ministry of Health will continue to provide regular updates and guidance as this situation evolves. Thank you, Mr. Speaker.